Let me just clarify one thing with regard to the Hyde Amendment. The Hyde Amendment was passed, I was a staff person here for the Honorable late Congressman Ron Dellums, when Henry Hyde inserted the Hyde Amendment in the mid-'70s. That amendment was to deny the full range of reproductive health care, including abortions, to low-income women and women of color. Thank goodness our bill did not include that after all of these years when we sent that to the Senate. And so the Senate, unfortunately, held it up, and the government could have shut down if it hadn't been for the negotiations. And so who sacrificed for making sure that the government would not shut down? It was low-income women and women of color. And we're going to continue until we provide equity, racial justice for everyone, every person in this country, and that includes Black and brown women and low-income women. And so, Mr. Secretary, I just want to make sure that's clarified, that the government could have shut down, and I'm glad that you signed the omnibus bill, but we're going to keep fighting until justice is done. So thank you very much. Let me ask you about HIV and AIDS. During the Labor Age Appropriations Subcommittee hearing last Thursday, you mentioned that the budget for the new $9.8 billion mandatory spending PrEP delivery program largely focuses on bulk purchasing of generic drugs. So let me ask you, with regard to the administration, why has it designated the funding as mandatory rather than discretionary? And have you connected with the stakeholders? And also, is there a consensus on how the $2.8 billion will be distributed? With the availability of low-cost generic and free drug programs for people who are uninsured, I'm hearing from the HIV community that access to the drug is not the issue. What I've heard is that clinics need funding to cover lab services and medical visits for the uninsured. There's also a need for community outreach programs and provider education and training programs and other wraparound services. And so can we ensure that the new PrEP program focuses on these support services also? And how is this going to be structured, given that it's right now not discretionary?
Congresswoman, I think, as always, this is the president's proposal. I suspect that you and your colleagues will try to work this budget to make it something that works as best possible. We'll be there to support. What we do want to do is make a commitment to make sure that everyone has an opportunity to have the life-saving therapies that are available now to anyone with HIV/AIDS. And we will do everything we can to make it affordable for everyone in America. And so we're more than willing to work with you. If you think there's some better ways of doing it, we are certainly willing to listen. This is the president's budget proposal. At the end of the day, as you just finished your discussion in terms of the omnibus, you all will determine what the budget looks like. But we hope what it will do is make a major investment in PrEP and doing all the things that we need to do to really tackle HIV/AIDS.
Thank you very much, and we'll work with you on that, because I think we have some ideas about a better way to do this. Also, the National Academy of Sciences, Engineering, and Medicine issued a report recently on primary care that estimates 85 deaths per day in the United States are the result of declining access to primary care. Your budget proposes a $5 million increase for training in primary care medicine, thank goodness. Is the proposed investment in primary care part of a larger strategy to address the growing shortage of primary care? And also, we're working with an initiative that the National Academy put forth in recommending some pathways and strategies for Black medical physicians and engineers, and the African-American community, is lacking in terms of African-American primary physicians.
And Congresswoman, COVID made it even more clear how much of a gap there is in getting professionals, healthcare professionals, into many communities in this country. And so we are absolutely committed in making a difference there. We want to increase the funding that we have for the pipeline of those medical professionals. We want to make sure that they are able to afford getting those medical degrees. And we want to make sure that we provide them. I should give you a real quick example. My son-in-law is about to finish in about 2 months his residency program as a pediatrician. He will be, as a result of a federal program, the Public Health Service Corps program, he is now about to serve for 5 years in a medically underserved area of the country. he was able to do that and go to medical school without having to pay for it because he's made that commitment to serve for 5 years.
Mr. Secretary, you said your son-in-law, Mr. Chairman, we served together in the California legislature, and I remember when your twins were born.
Yeah, that was
So congratulations.
yeah. So that's where they are now. She's now married, and her husband is finishing his residency program.
My God.
Yeah, I know.
Congratulations to you, too. So thank you again. We look forward to working with you.
Thank you.
Gentlewoman's time has expired. I now recognize the gentleman from Virginia, Mr. Klein, for 5 minutes.
Thank you, Mr. Chairman. Thank you, Mr. Secretary, for being here again. I got to speak to you last week